But today, we're here to talk about hepatitis C. And this is an exciting new initiative for our NMA. We know that hepatitis C is rising at a great rate in our populations, and it's becoming is an epidemic. And the good news is that we can test for it. The even better news is we're getting even better treatments to cure it, especially in our populations. Today, what you will hear will be multiple talks that will talk about the epidemiology and the overview and some of the treatment for it, and more importantly, we'll talk to you about what the NMA is doing with our Hepatitis C task force.
And we are very excited about the NMA Hepatitis C task force. So I just want to give you just a little brief information just to reinforce some of the things that you already know about hepatitis C. It is well recognized that the hepatitis C virus infection has become a major health problem in the United States, resulting in some 10,000 deaths annually. This number is expected to increase significantly by the year 2020. Some estimates indicate that the increase may be as much as threefold.
Good morning, Dr. Bright, Dr. Adi, Dr. Curry, ladies and gentlemen. First, I want to say that it's a great pleasure and it's an honor for me to be invited to participate in this program. Before I get started, I'd like to first congratulate Dr. Bright on his leadership of the NMA during this last year. And there are many initiatives that were initiated under his leadership, but I want to particularly thank him for the leadership in terms of the focus on hepatitis C as a public health problem in this country, but particularly in the African American community. So today I was actually asked to address you for 25 minutes, providing an overview of hepatitis C. So as a result of that, I've tried very hard to truncate my lecture, and so I hope to cover most of the topics that Dr. Curry indicated to you. But those that areas of interest that I do not cover, I hope that we'll have a robust discussion and have an opportunity to cover those. My disclosures are listed on this slide. I have just a few. And so the talk is going to take on, probably going to cover three main areas. One is the epidemiology of hepatitis C with a particular focus on the African American community. Then I'm going to turn my attention to some treatment considerations and basically provide the rationale for, efforts that are being initiated on a national level to identify patients with hepatitis C and to get them into to care and treatment as a means to control and prevent the complications of hepatitis C.
You're going to hear about hepatitis C for the next upcoming years as a multi-level, multi-layered approach. We are certainly very happy that the section chairs for both internal medicine, family medicine, pediatrics, and community medicine agreed to host this joint section. We have over 300 physicians that have been in the room today, and we are very happy, again, that these sections thought it right to partner certainly with the National Medical Association in promoting and educating on hepatitis C. Under the direction of Dr. Bright, the National Medical Association began to actually formulate a plan for how we should, as an organization, address hepatitis C. And this is very important because what I'm going to present briefly is the data. So it is not like the board or a subcommittee sat in a room and said, this is the plan. We first went to the experts within the NMA on treating African American patients, and that is you. All physicians within the body of the NMA are experts in their own right.